I'd like to go ahead and officially call to order the Committee for the Health, Hospital, and Social Services. We have the following members that are present: Gilmore, Hastings, Hurt, Pulley, Van Reese, and those are present at this time. So thank you for being here today. So we'll open up with Resolution 2018-1230, sponsors Vircher and Gilmore. It accepts a one key question grant from the March of Dimes Foundation to the Metro Board of Health to promote increasing preconception and interconception education for women of childbearing age in Davidson County.
Motion.
Second.
Okay, it's been moved and properly seconded. Are there any questions from the committee? Now we'll hear from Mr. Sharp.
The one key question is, do you plan to be pregnant in the next year? And then it's a fairly small grant, and if the answer is no, then they talk to you about what the options are. And the money is mostly for training and materials and different languages and so forth.
So what do you mean when you say if it's no, they talk to you about the options? What options would there be if there's a no?
Pills, IUDs, various and sundry types of long-acting reversible contraceptives. It's an education program for the women so that they understand what their options are, so that they can space the birth.
Options for not having a child.
Yeah.
Okay, I want to be clear. It's a lot of.
Do you want to have a child? The answer is no. Here are some options.
Yeah, it's not. Yeah, right. But that's not. It's not abstinence. We teaching plus, right? Yeah. Plus.
So, if the answer is no, where are they getting this? Well, it's not abstinence.
No, just birth control.
Birth control.
Forms.
Where are they getting that from?
Family planning clinic.
Family planning clinic.
Oh, health department.
Okay. At the health department.
Yeah.
Okay, that's good stuff. Good stuff. Are there any more questions?
No.
Yeah, might sound like crazy questions, but it's. I'm glad that the women have somewhere to go, because sometimes they want to go to other places, and people just kind of just wait all day out at the Planned Parenthood, which drives me crazy, and it could be there for other reasons, and it's just very aggressive kind of behavior. So I'm glad that they have other options and other places to go. All right. So how many? 4. All right. Seeing none against, it is recommended to the full body. Okay, I have to do. Got to. It is recommended to the full body for approval. I have to do a little count there. All right. So we'll go to the next one, which is a resolution 2018-1231, sponsors Vircher and Gilmore. Accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide food safety services, including restaurant inspections, foodborne illness complaints, investigations, and environmental health specialist network assessments. May I have a motion?
Motion. Second.
It's been moved and properly seconded. Are there any questions from the committee or discussion? Okay, Mr. Sharp?
In the public health world, the mothership is the Centers for Disease Control and Prevention. This is CDC money that flows to us through the Department of Health to pay for one employee who is an expert in foodborne outbreak investigations. He works with us at all times, but he is paid by the CDC, and this is his salary.
Wonderful. Now, how does he work with the, I guess, okay, yeah, no, I'll come back to that. Okay, are there any questions? Yeah, go ahead.
In the last year or 18 months, have there been any particular concerns about foodborne illnesses?
Not here.
Okay.
He does a lot of training with his staff, and he does actual restaurant inspections when he's not. I mean, he's working on it.
Okay, that's what I was going to ask
He's
about.
not sitting there waiting for an outbreak to outbreak.
Sounds good. All right. So how many? 4? All right. Seeing none against and none not voting, it is recommended to the full body for approval. The next one is Resolution 2018-1232, sponsors Vircher and Gilmore. It approves Amendment A to a grant from the U.S. Environmental Protection Agency to Metro Board of Health to fund an ongoing program to protect air quality to achieve established ambient air standards and protect human health. May I have a motion?
Motion. Second.
It's been moved and properly seconded. Any questions at this time from the committee or discussion? Okay, Mr. Sharp?
This one and the next one are both EPA grants for air quality monitoring. The first one is the original air quality monitoring program. It's looked at the gaseous elementary composition of the air. And the second one is PM, which stands for particulate matter, 2.5. which is the size, 2.5, whatever it is, milliliters or millimeters, little stuff. So there are two, you monitor for those things separately, and that's what these are for. And the reason these amendments come in periodically is you've got a standard amount. This is how much you're going to get over the next, I think they're 4 years, and they dole it out in bits and pieces over that period of time. So these will be amended numerous times over the course of the grant.
And so are we under the 2.5?
That's the size of the particle they're checking for.
Okay. So,
Check, see how much of that you've got.
right. So I guess I'll come to that one because I haven't done that one yet. But when I come back to it, I guess the question is still, are we under or over, even if they're measuring it, right? But,
Absolutely.
Right. But we'll have to take a vote on this one first. So how many are for? If there are no more questions, okay. All right, then it's recommended to the full body, seeing that there are none against and none not voting. Okay. So the next one is Resolution 2018-1233, sponsors Vercher and Gilmore, approves Amendment 4 to a grant from the United States Environmental Protection Agency to the Metro Board of Health for ongoing collection of data and on ambient air concentrations of 2.5 fine particulate matter in Nashville, Tennessee. May I have a motion?
Motion. Second.
It's been moved and properly seconded.
So the question is, are we under the standards? The answer is yes.
Okay, good deal. And so, do we know about how much?
I don't know the numbers off the top of my head. We post those on the website when they do they assess the data annually, and they post it a year at a time.
Okay, so they do it once a year?
Well, it's usually a couple years behind by the time they get everything done and put it up. I think 16 is the most recent year that's posted right
Oh,
now.
okay. Are there any more questions or comments for you?
Yeah, I have a question. This might be a little out of my realm to ask this question, but what are they looking for? Particular gases, or are they looking for actual particles?
And the PM 2.5 is actually
Yeah.
particulate.
Okay,
It's
so it's-
particularly bad for asthma. That's the stuff that gets.
That's what I was gonna say, because I have seasonal allergies, so that's why I'm like thinking, because, yeah, May, June, and November, or whenever I have trouble breathing in Nashville, and usually it has something to do with grasses or pollen or that kind of thing. So how does that take into effect as far as just natural instances of particles as opposed to?
This is looking for, I'm going to tell you more than I know about this if I'm not real careful.
Yeah.
But I think it's ash. It's stuff that blows up off
Okay.
the road. It's just little bitty
Okay.
fine bits of actual matter.
Okay.
I don't know if it's necessary. It may be, Paul, it may fall in there. But they're really looking for,
And they do it at different
Brain
times,
has
different
bits of fluid in the air.
different seasons of the year to kind
they
of.
monitor it all the time.
Okay.
I can get John in here and he can explain it to you at any length.
That's okay. I don't need to nerd out on it. I just wanted to, on behalf of everyone with asthma in Nashville, it is being checked. Okay.
And so is it covering, these are staff members? Is that what the grant monies are covering?
Staff members and the monitoring equipment.
So how does the equipment look? What kind of equipment is it?
It's an air monitor that sticks up in the air, and they've got filters that filter the air, and they take the filters out and they check to see what's in them. They know how long they've been in there. They know how much, theoretically, how much air has moved through there. They have models that tell you what all that stuff means.
And so do they take them outside, or is it something that's inside?
No,
Or
they're outside.
So they're always outside? Always? And they just go up there, pull it out, check it, and, okay. All right. Any more questions or comments? All right. We're ready to take a vote? How many for? Okay.
Don't forget,
Yep, he showed me, he said he was for. Thank you so much. Seeing none against and none not voting, it is recommended for approval to the full body. I'd like to thank everybody for being here as well. Everybody's present, right? That is great, right? So we're gonna respect that, and we're gonna keep it going, and then I want to get a quick update from, yes, Mr. Marco Villa. For that last resolution, your resolution's not on here. Shouldn't it be on here?
Which one?
About the boards combining and from us?
I think it's in introduction today.
Okay.
Oh, it'll come back.
Okay, I just want to make sure. Okay, all right then. Okay. Resolution 2018-1234, sponsor Gilmore. It approves a professional provider agreement between the Metro Board of Health and Blue Cross Blue Shield of Tennessee to provide health care service to its members. May I have a motion?
So moved.
Okay, wonderful. So I did want to hear more about this. Okay. If you could explain it, and I just wanted to see.
We've been working on this for a long time. Particularly after the Affordable Care Act kicked in with the marketplace insurance plans. Most of those are offered through Blue Cross. For our patients, clients that have insurance, we need to be an in-network provider. It saves them money and their insurance covers the cost. So this makes us an in-network provider from 2 of the Blue Cross plans.
Yeah, I saw it generated revenue, like, so I think it said like 20,000 or 20,000.
A relatively small amount.
Okay, good deal. Now, how does that have any impact on Nashville Metro General or none whatsoever? These are the same
I
clients
think
you
most
have?
of these people are probably seeing us already. I expect most of it will be parents who bring their kids in to get their shots.
Okay.
And have insurance.
All right, good deal. And so, but some shots, you're talking about vaccinations, right?
Yes.
Okay, because I know you do the flu shots for free, and then sometimes you do some other
They
shots.
start out costing a little bit, and generally by the end of the flu season, they're free.
Okay. Any more questions or comments?
On this, no.
All right, seeing none, we're ready to take a vote. All right. Seeing none against and none not voting is recommended for approval. We're about to end it, but we have,
I have a question for you.
sure, and I was going to allow, we have 3 people just to kind of give us a quick update real quick, but you go ahead and ask
Well,
your
that's
question.
why it probably is in your update. Just wanting to know what's going on with the hepatitis outbreak.
We are in Incident Command, which is a training that we all get on how to deal with issues like this. We meet every morning for 15 to 30 minutes or so. We've got an original shipment of 1,150 vaccines from the state. There is another batch that's through the state from the feds. It's 317B vaccine. There's another 750, I think, that have come to us. We've signed an agreement with Neighborhood Health and provided them with some vaccines so that they can provide them at 3 of their clinics downtown, the homelessness clinic, the Our House or My House.
My house is
My
hard.
House.
And the Madison.
one in Madison.
Yeah.
So they've got, I think, 50 and 150.
Okay.
Madison, downtown Ohio. And we are talking to a lot of other partners, including Judith, to see what we can do. We may take the shots out to homeless populations so that we can go where they are. So far, we've got 14 confirmed cases and 2 that just came in that are being investigated now to see if they're confirmed possible cases. And we usually have 1 or 2 a year, so that number gets your attention. And the reason we've reached out, none of them are, to date, so far at least, are homeless. But the reason we've reached out to the Homeless Commission and others is that in Louisville and San Diego and other places that are having an outbreak of this same strain of Hep A, if it takes hold in a homeless population, it tends to grow exponentially because of the lack of sanitary facilities.
Yeah.
So hand washing is a really effective way to deal with it. Vaccines help, certainly, and we will vaccinate as we're vaccinated all the clinics, all the health department clinics, and the 3 neighborhood health clinics right now. I know General has some. We've talked to them. They've got some now, right, Mark? And so we will move it out as we can. If any other partners want to actually provide it, if they have the medical facilities, they have to meet the VFC requirements for vaccine management and handling after refrigerators and all this other kind of stuff.
Right.
If they have that, then we have an agreement we put together that can be used for other partners if they serve one of the target populations, which are men who have sex with men, homeless population, and illicit drug users, not just IV, but other illicit drugs.
Well, I was wondering whether or not with Pride coming up only a couple weeks away.
We will be there offering vaccination.
Okay, good. Great. That's what I wanted to find out.
Questions? So does anybody just need to take it, or are you just only taking it?
Well, right now, the state-provided vaccine in the 317 is specific to the outbreak, and right now the target population are those 3 I just mentioned.
Okay, so
Anybody else can get it,
Right.
but they might have to pay for it.
Okay, all right, good deal. All right,
Great.
sounds good.
Is there, I'm sorry,
No, go ahead.
is there a particular page on the website with information about this that you have put up?
That's a good question. I know we've sent out all kinds of media
Or
stuff.
some
and-
sort of PDF or something?
I don't
This,
know
then
if it's
that,
separate. That's a
where to
good
go,
question.
that kind of thing?
I'll check.
Yeah, I think Brian.
Let us know, because then we can get that out, yeah, because between Streetworks and Nashville Cares and Pride, and there's a lot of places
Get
that,
the word out.
But we don't administer.
yeah, but getting the word out,
We just push it.
if you're, yeah, so,
I'll
if
check.
there's any community partners we can give it.
But Brian Hale has done an excellent job in touching bases with everyone and getting that information out. And I think it was Channel 4, was it Channel 4 that did the
It
article?
was one of the TV stations. That's
Yeah.
that's fortunately not my problem. I'll let
Because
Brian
if you're
know.
living with HIV, Hep A could be
And
extremely dangerous.
we've reached out specifically to the Ryan White provider, so that is a recommended procedure for HIV positive people
Anyway,
anyway, at all.
right.
Yeah, I just, with the vaccines being in high demand, okay.
Yeah.
Sure.
Now, I know the Hep A thing came up today with, just in conversation with my wife and I. I know it's a big spread thing that's going on right now. What are some of the symptoms from that?
It's diarrhea, vomiting, feet. It's like sort of like flu. You can turn yellow and look jaundiced.
Okay.
Most people recover within a few days or a week or so.
Oh, okay.
In regard, anyway.
Yeah.
But for some people, it can be very serious. It can be fatal.
Oh, okay.
And if you get it, you know it, you're going straight to the ER.
Oh, okay.
Yeah, so it won't be any question about it.
But
You don't feel very good.
You can
Yeah.
carry the virus up to 3 weeks before symptoms, is that correct?
I don't remember what the range is. The optimum is usually within a couple of weeks, but it may be long. It's probably can be longer than that.
So there is a cure for that stuff, or?
Vaccine.
Okay, all right.
It doesn't cure it. It keeps you from getting it in the first place.
Oh, okay.
And you said there's 14 cases that have been identified in Nashville at this point.
Correct.
You said 14. All right, thank you for always being so informative. Ms. Thackett, you had some information?
Yeah, it's one of the questions we got around it, and we're working with outreach providers to actually spread the word, and also with the health department to set up mobile locations. So we're organizing a plan and seeking input. But one of the questions we have gotten, because some media has reported on shortage, and the health department has informed us. I just wanted, so all of you are informed if constituents come, there's
No.
a shortage.
There's not.
So you can get the shot before, the piece I'm not clear about, you can get the shot before you even have the opportunity to outbreak, or you can only have it once you have the symptoms? That's the piece I'm not.
If you are in one of the target groups, if you're a man who has sex with men,
Okay.
if you're homeless,
Okay.
or if you're an intravenous, or if you're
So those are the
drug
target
user,
groups.
if you're
Okay.
one of the target
You
population.
go and get it. Okay, I just want to be clear.
And we track very carefully who gets it.
Okay.
And if it turns out that if there's some other target population we need to look at, then we'll expand.
Right.
But right now, those are the ones.
And you said at this time, the target population, though, there have been no homeless people that have shown up in those people that are the targeted population.
Of the 14
people.
positives we have, none of them are homeless.
Okay. Do
And
they
that-
fit the other two groups?
Pardon me?
Do they fit the other two groups that
No.
you? Okay, all right.
And I can also tell you that at Streetworks, because of the needle exchange program that we have, we are passing out information and referring them to Neighborhood Health and Nashville Health Department so they can go and be
That's very
tested.
good. Yeah, that's very important.
With
Thank you so
what
much
we're
for that.
doing, normally.
Yeah, no, thank you. That's important.
We've learned something since the 80s, hopefully, and that means that people have to take action now.
Well, and San Diego had a really bad, it still
Yeah.
had a really bad outbreak, and most of the cost, and it was in the millions of dollars to them, was because they waited too long. And so we would prefer not to be in that situation.
Thanks. So, do you have anything else to add? Do you want to talk a little bit about the commission, even though that's coming up next week? Because I see Father Strobel is here, and I'm assuming that you're part of that new commission that's going to be merged together. Did y'all want to speak to that real quickly, or?
It is an ordinance that's going to be introduced today so right now there is a dual governance system. One is the Metropolitan Homelessness Commission, and one is a HUD construct called Continuum of Care around homelessness, and there's a governance board there. So both of these boards have a goal to End Homelessness Build Housing Crisis Resolution System. And there have been months of talks and to come up with a plan on how to actually create one board. And that ordinance would do away with the Homelessness Commission and instead come up with this. It's going to be, it's proposed to be called the Nashville-Davidson County Continuum of Care Homelessness Planning Council. So if you have any questions.
And it has widespread support.
Yes, and it's, it really is going to be hopefully becoming a more coordinated effort. That's really the goal, to create a coordinated effort with a coordinated entry system, with outcome measures, housing-focused, person-centered, to get people off the streets as quickly as possible.
I like it. And I remember too that, so just remind me, does I saw a lot of the members, but does anyone from the council sit on it? It used to be that we had someone to sit on, okay.
We have currently 3 members. You were one before, yeah. But Freddie O'Connell, Mina Johnson, you were one before, yes, and Tanaka Berger.
Okay, and so they'll just move over to this continuum of care new board?
Yes,
Okay.
there is kind of an interim plan for that, to create that new board out of kind of with the 2 members. It's not a merging per se, it's a new creation because some people that are non-voting members will fall off. And then they have to organize, and the first meeting is really an organizing meeting, and hopefully planned in July of this next.
Okay. Well, thank you for the update. We appreciate that. And then, Mr. Overlock, if you could just give us an update, I mean, because there's so much in the newspaper, just kind of clear up so we can give everybody's messaging is on target. Yeah, and just about, I can think of the contracts, things like that. If you just want to kind of give us an update, that'd be great.
Okay, so our board met a couple of weeks ago and voted, of course, to extend Dr. Webb's contract. I can't speak for the board, but I think they had held off thinking that the hospital was going to close, so you wouldn't need a CEO. They have evaluative information that I believe they'll be sharing with him in the next several days. I think the contract negotiations are about to start. So there was some question about why would you do a 3-year contract? Well, if you're trying to, frankly, recruit or retain a CEO that you like and you want to keep, you don't just give them a month-to-month agreement. In any event, whatever contract results will be contingent on the hospital maintaining operations. So if the council and the mayor decided, well, we don't need General Hospital
We're
anymore.
not doing that. We're not going down that road. We'll have none of that talk, Mr. Overlock. None of that talk. None of that type of talk. We've come too far. We're just looking at to see how it works. Okay, so good deal.
So the other thing, of course, we want to thank the mayor's office and the council, because this is the first time in my experience that we've actually had the correct amount of funding to get us through the next fiscal year. And so it's really changed the optics. It's actually affecting our ability to recruit. So we had a recruitment fair a couple or 3 weeks ago, and we actually had people fly in from out of town. And we had 156 potential employees come through and interview. And so we made 20 hires on the spot, including several nurses. So, and of course, if you don't have nurses, you have to go out to what are called temp agencies and bring them in, and they are twice as expensive.
$80 an hour, right? When it only $35 an
And the
hour.
temp nurse doesn't get the $80 an hour. The agency gets most of the funds.
Right. Well, that's
Very exciting.
really exciting news. So thank you for sharing that. And yes, we do appreciate the mayor's office as well as the council, because you've been working at Nashville Metro General how many years now?
My 15th year.
15th year, and this is the first time
time it had been
that they've gotten the full funding. Oh my God, that is just like really exciting, right?
I was just there yesterday and met with the CEO, and actually there were some things going from one of the hospitals, for-profit hospitals, that a doctor is actually they're looking to hire. This doctor for the for-profit hospital wants to come and work at our facility. So it's changing. The grid is changing, and really, really happy to see that. I know we're having a lot of moves that are going on with the board of directors, but we hope that to be a good thing, and we're going to continue to go with the roles. I know they have a positive cash flow that's going on right now for several months. We made millions of dollars on the positive side, so that is, I just wanted to mention that to all of us so that we can feel good about we did the right thing.
I think so. So thank you so much. Thank each of you, and yes, ma'am.
Mr. Strobel wanted to speak maybe when you were talking about the homeless Homeless Commission.
Okay.
I just wanted to
That's
ask.
fine. I thought I gave Father Strobel a chance, and he said no.
Thank you. I'll take a couple of minutes. That's a brief history of the best house in the room in the inn.
Okay.
Campus for Human Development. And we heard today that we would be cut $50,000 from our budget. And it's a surprise, and it really means that we would have to reduce services. And so I'm calling upon your goodwill to help support us and not have that cut of $50,000 from. We were told that the budget would be the same as last year, and we're prepared for that. But this is a surprise, and I don't know if Judy can speak to it.
Speak to it, because I'm in support that we retain the funding as is for room and inn. Here's the thing, I've been very open throughout the budget process that we need more money at the Metropolitan Homelessness Commission. And what the vision is, we have become the HMS lead, and there's additional dollars that are expected.
HMIS stands for?
Homeless Management Information System. It's a database that really is the key of that coordinated entry process. And I have presented about it and was really, have been working really great with Metro to be able to present a budget, even, with what the vision is, and then also work with them what would be the minimum that we need. And I've been in touch with all the partners that there's a possibility for, if there is no money that can be secured, then we will have to go look at where is the money going out within the existing budget. And I really, really hope to avoid this consequence.
So I think maybe you can explain maybe like in a minute or so, the importance of the system and how it coordinates. For maybe people don't understand the management system, and then we'll wrap it up from there. So
the continuum of care votes, that's the community around homelessness, and votes on who is the local homeless management information system lead. So far it's been MDHA. We at the commission have paid for the contract, but we are getting through a grant that MDHA gets that will be transferred to us. It will come before you, money for position. We know that the HMS lead, there is a software cost with that is going to be up for RFP this next fiscal year, and that's going to shoot up. We just know that's going to happen. How much? I don't know, which is really hard to come up even with all the budget and all that. Overall, when we look at peer cities, our HMAS is completely underfunded, which was exactly what the entire budget request was about, to really give Metro an idea of what really needs to happen around HMAS.
So is it for a more robust system?
Yes.
Okay.
Yes.
Would it be 4% or a budget, a capital issue and not a budget issue?
I don't know. I would have to ask. That's all I'm trying to.
Software.
It is
Software,
then that can be.
Yeah.
And I have submitted every which way, also as a 4%, and been in touch with Room and Inn and all that, and always been very clear, this is not where we want to go. So I am fully in support whatever we can do.
Yeah, that's what I was going to ask you. So in what area, do you know what area it was cut from in our budget? Do you know?
It is pretty much in a nutshell, we're taking an additional task that's not fully funded.
Right.
So we have to find that money somewhere.
Oh, that's the area.
If it's not, I asked for it. If it's not coming, it has to come from the existing somewhere.
Okay. All right, so we will continue to talk about it. Thank you so much for giving that explanation. Does the committee have any more questions or comments at this time?
Well, the comment that I have, thank you, Chair, is that we get so many requests. The budget is tight. And there is a proposal out there for there to be an increase, a small increase that can help solve some of the problems that we have. So I encourage you to talk to your council members and ask them, and we hate that we are in this predicament, but we're here. And this is a solution for us to be able to do some of the things that we promised that we would do. And all of us can come in to help fix the problem regardless of how we got there. And we will be better managers of the money. And I think that under the administration that we have, there is going to be more inclusion. There's going to be more input from the council and the people who are going to ultimately make the decision. And if you would encourage them, then it gives us at least some progress to move forward to take care of some of those things that we now think are going to be taken away.
I think that's a great point, yeah, because it's going to take some courage. So, yeah, you're going to have to talk to the other council members. It's not easy because no one wants to do a reassessment. I think to speak to Council Lady Hurt's point, it's the right thing to do. And to me, this is the first time that the budget has really been about people and not things. A lot of things that we're talking about in this budget is really people-based, right? So we're talking about COLAs, we're talking about kids. A lot of times it's big projects.
Homes,
so, yeah.
police,
Yeah.
the safety,
Yeah, and it's not comfortable,
education,
right? So,
all of
yeah, I
it.
think that's a good point. So I won't belabor it because I don't want people to not stop coming to our committee meetings since we have everybody here. So we'll wrap it up. Thank you so much for each of you being here. I appreciate you so much. Thank you. Have a good rest of the evening. This concludes our meeting. Yeah.
Yeah.